My name is Robert Burke. This is my 28th year with the Fondren Orthopedic Group. I am an orthopedic surgeon with specialty interest in joint replacement, arthroscopy, as well as cartilage restoration. I enjoy fixing things. I enjoy greatly making patients better. The greatest satisfaction that I ever get is when a patient comes to me in my office and tells me that they've referred a friend or a family member. That is the highest compliment that any patient can give me, and I take that extremely personally. And that really is why I do this day in and day out. Well, my patient population, as far as what I treat, varies either from relatively young patients in their mid-teens to elderly patients that may have the need for joint replacement, specifically knee or hip replacement. So the thing I enjoy best about my practice is I get sort of to see the gamut. I see knees that have just a simple meniscal tear or an ACL tear, to knees that have terrible arthritis that need joint replacement. One of my main interests is in cartilage restoration, and there's two techniques that this can be done. One is with biological treatment, such as stem cell therapy. The other is with a technique called autologous cartilage implantation, and that's where I actually take a biopsy from a patient and can actually regrow their cartilage in a cell matrix and to reimplant that in their knee after a period of usually 4 to 6 weeks from the initial procedure. The major advantage of the autologous cartilage implantation is we're actually regrowing normal cartilage, which is a huge step forward as opposed to doing techniques that can establish scar tissue in the knee. Scar tissue does not have the mechanical properties that normal articular cartilage does. And so the holy grail of orthopedic surgery has always been, what can we do either to repair articular cartilage or to prevent it from becoming arthritis?